Hi everyone, welcome back to our channel. Today we will discuss about the most important MCQ for NORCET and other nursing exam. Let's start. First question. A patient is admitted with 40% deep partial thickness burns. Which is the most reliable indicator of adequate fluid resuscitation in the first 24 hours? Option A, skin turgor and moist mucous membranes. Option B, maintaining a heart rate below the 100 beats per minute. Option C, hourly urine output 30 to 50 ml. Option D, a systolic blood pressure greater than 100 mm of Hg. The answer will be option C, hourly urine output, because in burn management urine output is the gold standard for monitoring organ perfusion. Organ perfusion. So according to the Partland formula, half of the fluids are given in the first 8 hours, 50%, then second 16 hours we have to give 50% of the fluids. While BP and the heart rate are helpful, they can be affected by the pain and stress. Urine output directly reflects renal perfusion and the cardiac output. So the answer will be option C, hourly urine output of the 30 to 50 ml. Next. A nurse notes a sawtooth pattern on the ECG monitoring of a patient. Which cardiac arrhythmia is the patient likely to experiencing? Option A, atrial fibrillation. Option B, atrial flutter. Option C, ventricular tachycardia. Option D, ventricular fibrillation. The answer will be option B, atrial flutter, because atrial flutter is characterized by rapid regular atrial depolarizations that creates a classical sawtooth appearance. Classical sawtooth appearance. Atrial fibrillation would show the irregular rhythms with no POF. So the answer will be atrial flutter, option B. Next. A patient receiving vinclitine for chemotherapy reports numbness and the tingling in the fingers. Which action should the nurse take first? Option A, reassure the patient is a common side effect. Option B, apply warm compress to the hands. Option C, notify the healthcare provider immediately. Option D, administer an analgesic. The answer will be option C, notify the healthcare provider immediately, because peripheral neuropathy is a major dose limiting toxicity of vincristine. Numbness indicates the nerve damage. Numbness indicate vein damage. Nerve damage. The medication may need to be stopped or the dose adjusted to be prevented permanent neurological defects. So we have to immediately notify the healthcare provider. So the answer will be option C, notify the healthcare provider immediately. Next, the client with schizophrenia says, the stars are talking to me through the radio. This is an example of option A, hallucination, option B, delusion of reference, option C, illusion, option D, neologism. The answer will be option B, delusion of reference. The false beliefs. Delusion of reference means the false belief that the insignificant remarks, objects or event like radio signals or the stars have personal meaning or direct message sending for the individuals. And hallucination would be hearing a voice when no sound exists. Here the patient is misinterpreting an external sources, and illusion is when a substance is there and the patient will misinterpretation with their objects. And hallucination means the things are not there but the patient thinks that it exists. It's known as the hallucination. And neologism means the patient will make new words or sentence but the words should not have any meanings. Next, a patient with a serum potassium level of 6.2 MCQ per liter is admitted. Which ECG changes is the most expected? The normal level of potassium is 3.5 to 5.2 MCQ per liter. So here the potassium level is increased. Let's see the option. Option A, prominent U wave. Option B, depressed ST segment. Option C, tall peak T wave. Option D, prolonged QT interval. The answer will be option C. When the potassium level will be increased, then the T wave is peaked. It's happened in the hyperkalemia. Typically causes tall tended T wave and wide and widened QRS complexes, and eventually the loss of P waves. U waves are classical sign of, and U wave are the classical sign of hypokalemia, and prolonged T wave, peak T wave is an hyperkalemia. calemia. So the answer will be option C. Next, which of the following is the priority nursing intervention for a patient with the appropriate placenta? Option A, perform a vaginal examination to check the cervical dilation. Never perform the vaginal examination during the abruptio placenta and the placenta previa. So this will be the wrong answer. Option C, administer oxytocin induced in the labor. During the abruptio placenta, don't administer oxytocin. So the answer will be C will be not correct. Encourage the patient to ambulate to relieve the pain. No, placenta vaginal examination are strictly contraindicated, and in the placenta previa rule out, and the priority should be monitoring the fetal heart rate and the maternal vitals, because placenta previa is a rule out as they can cause the massive hemorrhage. They can cause the massive hemorrhage. The priority assessing for the fetal distress and the maternal shock. So the answer will be option B. Option B is the correct answer. Next, while administering a cleaning enema, the patient complains of the abdominal cramping. The nurse should, option A, stop the procedure immediately. Option B, lower the enema bag to slow the flow. Option C, advance the rectal tube further. Option D, ask the patient to hold the breath. The answer will be option B, lower the enema bag to slow the flow, because cramping is often caused by the rapid introduction of the fluid. Or the temperature of the fluid. By slowing the flow, the nurse allow the intestinal muscle to relax without stopping the procedure. So the answer will be option B. Next, a patient with diabetes insipidus is most likely to exhibit which clinical manifestation? Option A, excessive thirst and low urine specific gravity. Option B, high blood glucose and ketones in urine. Option C, peripheral edema and weight gain. Option D, low serum sodium and concentrated urine. The answer will be option A, excessive thirst and low urine specific gravity, because in diabetes insipidus is caused by a deficiency of ADH. This leads to massive diuresis. Diuresis means polyuria. Because the urine is so dilated, the specific gravity will be low. Specific gravity will be less than 1.005. So the answer will be option A, excessive thirst and low urine specific gravity. Next, which personal protective equipment should the nurse don first when entering a room under the droplet precaution? Option A, gown. Option B, gloves. Option C, surgical mask. Option D, goggles. The answer will be option C, surgical marks, because droplet precaution requires surgical marks within 3 to 6 feet of the patients. While gloves and gowns are used to contact precaution, the defining PP for droplet is the marks. So the answer will be option C. Next, in a child with tetralogy of Fallot, a TET spell, hypercyanotic spell occurs. What is the priority nursing action? Option A, administer 100% oxygen via face mask. Option B, place the child in a knee chest position. Option C, administer morphine sulfate IV. Option D, start an IV bolus of normal saline. The answer will be option B, place the child in a knee chest position, because the knee chest position increase the systemic vascular resistance which reduce the right to left shunt in the heart and improve the oxygenation to the lungs. This is the fastest non-pharmacological way to stabilize the child. So the answer will be option B. Thank you everyone. Please like our video, subscribe our channel, like, share and subscribe. Thank you everyone.